What concerns me most is that we are in a period when we are receiving cuts of every kind. And those of us, not only in the HIV caucus, but among many members of Congress, are very concerned when cuts are made where we have achieved some progress. And I should tell you that I know of the current appropriation that there is on the House side, what we call level funding, no increase. And would you believe that is considered a win in this Congress? Because the president indeed put in a budget for almost 20% cut. And on the Senate side, we don't know yet. But that means that when the appropriation comes up, and you may know that we're probably going to get a 2-week extension, we're going to get a number of extensions because it still is controversial, that at least we ought to be able to get no cut, which is a cut. Because of course, expenses go up, costs go up, and when you get no increases, you don't account for inflation. And whatever is the targeted and important issue gets hurt. And that's what's going to happen with HIV, where we'll achieve some progress and may lose that progress.
Indeed. Phill, can you speak about that in relation to Black people and the communities that you work with in your nonprofit?
Certainly. You know, there's a huge elephant in the room. Dr. Fauci and Ambassador Birx talked earlier about these new tools we have. And certainly we have some tremendous advances over the last few years. And we have new and better tools, better diagnostic tools, better surveillance tools, better treatment tools, better prevention tools. But here's the rub. None of it matters if people don't have access to health care.
Right.
Full stop. You know, ending the AIDS epidemic in our lifetime is over if people don't have access to health care. So the biggest threat that we have today is making sure that people have access to these tools. Earlier they talked about how it's difficult to reach Black, gay, and bisexual men. Well, quite frankly, I'm tired of that because we're not difficult to find. People are not interested in looking for us. So that's the deal. And so we need to make sure that the tools are there, but that they're available to people and people have access to them.
Jesse, when you think about access, are there parts of the country that you see disproportionately not receiving the amount of education and attention that this illness deserves in their communities?
Well, the southern United States is unfortunately having an HIV hurricane, literally. Literally, 40% of the people living with HIV are in the South, for more than half of new diagnoses, the new infections, all of those are primarily happening in the South. So we have to really focus on the community will, and I loved what Ambassador Birx said earlier. The political will needs to be at the community level as well as at the national level in order for us to expand access to care. 40% of people living with HIV access their health care through Medicaid, and those states in the South where Medicaid has not been expanded. So the pathway to getting to access to care is actually closed for a lot of people, particularly in the South.